Next is Dr. Radhika. Newer parameters for early keratoconus diagnosis on anterior segment OCT.
Good afternoon, everyone. I am Radhika Dashputra. I am third year resident at Guru Nanak Eye Center, and I will be presenting newer parameters for early keratoconus diagnosis on anterior segment optical coherence tomography. As we all know, keratoconus is a progressive disorder characterized by central paracentral corneal stromal thinning. Diagnosis of manifest cases of keratoconus is based typically on slit lamp examination and topographic findings. However, early diagnosis continues to remain a challenge. Role of epithelial mapping has been explored by many recent studies. In 2010, Reinstein et al. Used very high frequency ultrasound to describe a localized central zone of thinning surrounded by an annulus of thickened epithelium, which they called as donut pattern. Yanli et al. Have conducted multiple studies in OCT-guided epithelial mapping, and they proposed epithelial asymmetry and thinning in the area of cone as an early marker for diagnosis. In 2015, Reinstein et al. Temstead et al. Proposed a diagnostic threshold of 52 microns for minimum epithelial thickness for diagnosing form thrust cases. However, a study by Sandali et al. In 2013 found epithelial thickening in the area of cone in advanced cases. This uncertainty in the nature of epithelial compensation led us to conduct a study to analyze ASOCT corneal, pachymetric, and epithelial pattern in different stages of keratoconus and to determine its supplemental role in early keratoconus diagnosis. It was a prospective cross-sectional study with 5% level of significance and 95% power. 100 eyes of keratoconic subjects in the age group of 7 to 25 years were recruited for the study. Normal eyes were also taken as controls. Patients with advanced disease and corneal scarring were excluded from the study. All the subjects underwent detailed ophthalmic examination, including slit lamp examination and topography. ASOCT pachymetric and epithelial mapping was done using a commercially available software. The parameters that were considered in pachymetry for further evaluation were pachymetric difference between the superonasal and inferotemporal quadrants, superior-inferior difference, minimum pachymetry, location of minimum pachymetry along y-axis, minimum median difference, and in epithelial parameters, minimum epithelial thickness at the minimum pachymetry, and standard deviation of epithelial thickness and zonal thickness in superior, central, and inferior quadrants. These are the results of our study. The subjects were distributed in different grades of keratoconus according to the Amsler-Krumig classification, and fellow eyes of unilateral disease were labeled as form thrust according to the definition proposed by Amsler. In the pachymetric analysis, the minimum pachymetry showed a decreasing trend with increasing stages of keratoconus, which is a well-established fact. However, other pachymetric variables did not show a specific trend. In epithelial thickness mapping, there was a significant difference between groups in minimum epithelial thickness and epithelial thickness at minimum pachymetry without a specific trend. The standard deviation of epithelial thickness, which points towards epithelial asymmetry, showed an increasing trend with advancing grades of keratoconus. To determine the diagnostic accuracy of these parameters, we conducted a ROC curve analysis. The superonasal inferotemporal pachymetric difference and the standard deviation of epithelial thickness had good area under the curve with clinically significant cutoff values obtained using the Jordan's index. Using a cutoff value of 32 micron for superonasal inferotemporal pachymetric difference, keratoconus could be diagnosed with 75% sensitivity and 80% specificity, and a cutoff value of 2.5 for epithelial thickness standard deviation diagnosed keratoconus with 77% sensitivity and 84% specificity. I would now like to briefly run you through a few of our representative cases. This is a 20-year-old male who was diagnosed with stage 2 keratoconus in his left eye. This is the Scheimpflug topographic image of his right eye. Seen in isolation, it appears to be within normal limits. The enhanced ectasia display also does not show any hotspots. However, the ASOCT pachymetric and epithelial mapping shows that the superonasal inferotemporal pachymetric difference and the standard deviation of epithelial thickness is elevated above the diagnostic cutoffs, which would make one immediately suspicious. This is a 24-year-old male with grade 1 keratoconus. On epithelial mapping, we see what has been typically described as a epithelial donut pattern, area of thinning surrounded by an annulus of thickened epithelium. In conclusion, I would like to reiterate the two diagnostic thresholds: superonasal inferotemporal pachymetric difference of 32 micron and standard deviation of epithelial thickness more than 2.5 as a screening tool for early diagnosis, warranting further evaluation and a closer follow-up. Thank you.
Did you observe any relation between the epithelial thickness and corneal thickness?
So not specifically, but there was a generalized trend towards decrease in both of them with advancing grades of keratoconus.
Yeah, nice paper. When you compared the diagnostic criteria using epithelial thickness mapping vis-a-vis what we commonly follow on topographic criteria, were the percentages of your classifications different, the various grades, or you did not find any difference?
No, that was not analyzed, ma'am. Only a dichotomous variable for ROC analysis was taken as either control or the
so
keratoconus.
not part of your methodology.
No, not part of my methodology.
Thank you.
Thank you for your